Welcome to Arthritis Help. I'm Dr. Dave, physical therapist, teaching you how to move differently so you can feel better. A common exercise that I've seen done incorrectly is the bridge. Lots of people do it, lots of people do it wrong. I'm going to show you how to get the most out of your bridges. So first you're going to be lying down on your back. Knees are going to be comfortably bent. And what I see most people do is they lift up and they lift up as high as they can and they wind up leading with their belly and arching their back and using a lot of low back muscles and not butt muscles. And the whole goal of the bridge is to get your butt muscles activated. But if you lift from your belly, your butt's just coming along for the ride. It's not really working. So what I want you to do is this. I want you to think about rocking your pelvis back. I want you to roll the pelvis backwards rather than lifting the pelvis upward. When you roll the pelvis backwards, it'll come up off of the table, but the back is going to stay flat. So I want to see how much can you lift your butt, but not lift your back. And when you start to do that and keep the back down, the butt is going to feel active. You're going to feel these butt muscles working. You might even feel stretch in the front of the thighs here or the front of the hips, opening up those hip flexors. All right, so you want to feel that you're rolling the pelvis back, keeping the back down, and lifting the bottom up. Now, if you want to go further, you can, but we're going to lift the vertebra up one by one on the back. The belly is always going to stay contracted. We're never arching the back or elongating the belly. And so you roll and you only go as far as you feel like you need to, okay? Some people, very often doing this exercise, get a cramp in the hamstrings. If that happens to you, first thing you do, straighten out your leg and lift it up. That's going to alleviate that cramp. If you don't want that cramp to happen again, you need to do two things. One, you're lifting from the belly, and that's going to make the hamstrings activate instead of the butt. So you need to roll the pelvis back. Two, take your foot, don't just push it down, but forward a little bit, like you're trying to slide your feet forward, and think about elongating your thighs over your knees as you roll that pelvis back. If you do those two things, it's going to activate the butt muscles and not the hamstring muscles, so you can rise up. If you make those changes, you're going to get a lot more out of your bridges and you're going to get a lot more activation out of your butt. Now, if you want even a greater workout, what you can do is you can take two hands and just hold on to one knee, and then you can do the same exact thing. Elongate the thigh over the knee, roll the pelvis back, and do it with just one leg, and roll as far back as you feel comfortable and get that nice butt contraction again. Try not to over pull with this hand into the knee, just let that leg come along for the ride. Roll the pelvis back. Think about elongating the thigh over the knee as you rise up and engage those butt muscles. Do not try to get super high. That's just going to engage the back muscles. You're going to do the same exact thing on the other side. Hold it in, elongate the thigh, roll back, and feel the foot pushes down and forward and that nice activation through the butt. If you make those simple changes, you're going to get so much more benefit out of that exercise. And if you're taking the time to do the work, why not get the most benefit that you can? I'm so glad that you joined me today, and I'm so glad that you took the time to do the things to help yourself. I'm going to see you next week with a whole new video teaching you how to move differently so you can feel better. Take care, everyone.